Hello, everyone, and welcome. Welcome. So glad you could call us could join us today. My name is Dwayne Heisler. I'm the campaign director for the Pennsylvania Policy Center and Pennsylvanians Together. I know that I don't need to tell folks in this space right now what is happening, what's going on in our country, and how critical things are in this moment. And so, with that, I want to jump right in and introduce and thank Congressman Brendan Boyle. It is an honor to have you join us today. Congressman Boyle is a ranking member of the House Budget Committee, which is so critical right now, and also on the House Committee on Ways and Means. So, Congressman Boyle, I'd like to immediately turn it over right to you so you can give us the latest.
Yeah, well, thank you, Dwayne, and to Mark and to everyone at your wonderful organization for all of the great work you do. And for the folks who are joining us, see a bunch of people on the Zoom and some familiar, very familiar names as well. I hope that everyone is feeling as excited and mood and spirits lifted because of the events of just a couple nights ago. And I do want to take a moment just to address that. My goodness, I have never seen a bigger whooping at the polls in my lifetime. Certainly in terms of our side, I lived through 2010. It was my first reelect as a state legislator then, and was happy to survive as Republicans were unfortunately picking up 63 seats congressionally in that election. But even 2018, which was a blue wave, and 2006, which was also a blue wave, I've never seen an election like Tuesday in which from every office to every county in Pennsylvania, replicated in all 50 states, we had blowout Democratic win after blowout Democratic win. Governor's races, mayor's races, DA, sheriff, judicial retention, open judgeships, as local as it gets, as statewide as it gets, and everything in between, and including and especially that important referendum in California. So you do not get an election that overwhelming and sweeping unless there's one unifying cause. And that cause, in my view, is the chaos that this administration and a Republican Congress has unleashed on the American people. You have now seen the first election of what I believe will be several in which the American people are voicing their outrage, their displeasure, and their strong desire for change. Now, there's one person who actually would agree with some of my analysis, ironically, and that's President Donald Trump. As he himself acknowledged on social media, I refuse to call that social media site by its ridiculous, inaccurate name. But as President Trump posted on his social media site a couple nights ago, and again reiterated in front of the TV cameras yesterday morning, the American people blame Republicans for this shutdown. The American people are right. This shutdown was entirely unnecessary. It could end literally today. All we would need Republicans to do is finally negotiate with those of us on the Democratic side who want to see an end to the shutdown, provided we also save the health care of the American people. And I want to go back wearing my hat as the lead Democrat or ranking member of the Budget Committee. I do want to bring us back to the original sin in all of this in terms of the shutdown. And that is the bill that passed just a few months ago, because I want to make sure, especially between now and next November, it is not forgotten. It is what Trump used to call the big, beautiful bill until it became so deeply unpopular, he's just stopped talking about it altogether. What in reality is the big, ugly law strips health care away for more than 15 million Americans, the biggest loss of health care in American history. That is not my numbers. That's not the Penn Policy Center. That is the official source, the nonpartisan Congressional Budget Office. that shows at least 15 million Americans will lose their health care. And for tens of millions more, they will see their premiums go through the roof. That means if you're on Obamacare, that means if you're on Medicare, and that means if you're on Medicaid, but also if you are one of the 160 million Americans who get your health care from your employer, you also will see your premiums increase. I have spoken to a number of hospital leaders from an urban area like Philadelphia and some of the hospitals that are in my district, like Einstein and Temple University, also to hospital leaders in rural areas who have all told me they don't know how they're going to be able to survive when you are inflicting over $1 trillion worth of healthcare cuts to our system. By the way, why did they push through a bill that cuts over $1 trillion from healthcare? Was it deficit reduction? Was it to make other investments? No. It was to provide trillions of dollars in tax breaks to multimillionaires and billionaires. So we Democrats want to say enough. We are fighting back. We have the American people with us. And I hope there are at least some sensible Republicans in Congress who we know are so afraid of Donald Trump that even though they know that everything that I just said is correct, they have nonetheless, to this point, been too afraid to speak up. Well, I hope that begins to shift. Not that they suddenly become more moderate or courageous people. I'm not that naive. But I hope what shifts is looking at these results from Tuesday. House Republican and even some Senate Republicans who are in districts or states that Donald Trump won, but by single digits, all of a sudden start to become more afraid of their angry voters and constituents than they are afraid of Donald Trump issuing a mean tweet. So that is the situation at the moment. I wish that it was better news in terms of what we're seeing from Congress, but I have to say this is the best news that I think we've had in exactly 1 year. And I am very much looking forward to having a similar conversation in as celebratory a mood a year from now as I am right now. And I'm happy to open it up to any questions.
Thank you so much, Congressman Boyle. And there is a question in the chat from Jennifer Parteka. Nurse here, hospitals will close and your communities will be less safe. Acute care beds are already a scarce commodity. Donald Trump, maybe it's more of a comment. Donald Trump is a hazard to your health, but I'm wondering from your perspective and what you've been hearing on the Hill, how impactful is this in Congress, Congressman Boyle, about what this means to our local hospitals and caregivers across the country?
Yeah, so first, before I address that, let me say there are obviously other elements in terms of this shutdown fight, and there were certainly other awful things in the big ugly law, such as the largest cuts to SNAP in American history. You have two great speakers after me, my wonderful colleagues, Mary Gay Scanlon and Madeleine Dean. So since I just had limited time, I wanted to focus exclusively on healthcare, and I'm sure over the course of the next 45 minutes or hour, you'll delve into all the other awful consequences of that bill. But specifically to the question on healthcare and the impact it will have on the system, let me give you a concrete example. So I mentioned that Temple University Hospital is in my congressional district. Between Medicare and Medicaid, about 80% of their patients are on one or the other. Some are what are called dual enrollees. So basically, only about 20% are private payers, 80% on Medicare, Medicaid. What do you think is going to happen to Temple University Hospital or Jeans Hospital in the Northeast, which is in its system, or Fox Chase Cancer Center, which is also in its system and treats a lot of people in the 5-county area, one of the premier cancer research centers in the country? Their whole system is in jeopardy, not just the patients who happen to be on Medicare and Medicaid. We see the same thing replicated in other areas, especially rural areas. So a lot of the focus the last few weeks, you've heard a lot about the Obamacare exchanges here in Pennsylvania. The exchange is called Penny. Penny has already released the data that on average, premiums for anyone who's on Penny will increase 102%. I have seen similar or even larger increases in other states' Obamacare exchanges. It just so happens that those are the cuts that are taking effect first. January 1st is when the Medicare cuts to providers take place. And then finally, around this time next year, the Medicaid cuts begin to take effect. So this is like a slow rolling crisis that will only compound upon itself, kind of like a snowball rolling down a hill that will just get bigger and bigger, and by the end, be a wrecking ball to our healthcare system.
If you have time for it, there's another question in
Yeah.
here. I know you have to leave shortly, but the question is from another Jennifer Barr. What are the Congress members discussing regarding the shutdown between themselves? I think is what's there, especially GOP members who might believe that Congress should be back in session, and then and negotiating. What
Yeah.
are they saying to each other?
It's a very reasonable question. I started to chuckle because, as Mary Gay and Mad will attest, we're not having any conversations with Republican House members because Speaker Mike Johnson has shut down the House of Representatives ever since late September. He first canceled the last week of September because he was afraid about having to vote on the House floor regarding releasing the Epstein files. And then he has just kept us out ever since. We are now 6 weeks into the House of Representatives being shut down. I like to joke that Mike Johnson is trying to bring back quiet quitting, where he has just decided that we're going to close the House of Representatives, forget passing any legislation, whether it's about the shutdown or anything else. So every other shutdown that I've served through, we've typically been in session nonstop, including on weekends. This is the exact opposite, where you have a Republican speaker, shamefully, who has shut down the House of Representatives, the people's house, not at all meeting. I was proud to stand with Mary Gay and another colleague of ours, Dwight Evans, on Monday, where all three of us reiterated our call to immediately bring us back into session so we can have those private conversations with House Republican colleagues, especially those who finally, after seeing Tuesday, may have seen the light, again, more out of their own self-interest than anything else, but may have seen the light and would be willing to compromise.
Wonderful. Thank you, Representative Boyle. I see that your time is done here and you need to jump to other things. So much appreciate you jumping on the call, giving us that insight and helping us, and look forward to you joining us again. You've been on these calls before, and I know that the feedback we get for you is just incredible, getting that insight. So thank you so much for all
Yeah,
that you do. And
thank you again, and thanks for what all of you do.
wonderful. Thank you, Congressman. It is also my honor to introduce and welcome Congresswoman Madeleine Dean. I'll just turn it right over because I know you're on a time constraint as well. Everyone is in DC in this moment, but I wanted to jump right in and have you give your insights, and then immediately following that, we'll have Congressman Mary Gay Scanlon join us as well. So, Congresswoman Dean.
Terrific to be with you. We may be on time constraints, but contrast that with our House Republican colleagues. They're off. They're home. They're on vacation. I don't know what they're doing. It's been a ghost town. You'll notice that Democrats have been going down every single week. Hakeem has called us in multiple weeks. Democrats are there, eager, anxious, urgent, wanting to do the work. And we see none of that on the Republican side, particularly from the Speaker and Republicans in the House. But I thank you for inviting me today. Dwayne, it's good to be with you again. And Mark, thank you very much. Thank you, Adrian, for pulling us all together, and all of the others from Penn Policy Center. I'll be brief. I think what Brendan said was just terrific. I echo all that he just said. We've had the chance, the three of us, to work together an awful lot during this shutdown, and of course before. And I want to give him some shout outs because as ranking member of the budget committee, he's offered really good data in terms of this shutdown, in terms of the healthcare impacts that I'll share with you in just a second. So when I was invited, I was told, Dwayne, that I could talk about the latest on the shutdown, healthcare costs rising, SNAP cuts, and the devastation there. But I too want to start where Brendan started. I won't reiterate what he said, but man, oh man, Tuesday was just an extraordinarily positive day across this country, from California, Prop 50, over to the East Coast, Virginia, New Jersey, Pennsylvania, New York City, and take a look at Georgia. The elections are really important. And we all worried that maybe Mikey Sherrill, who is our classmate, Mary Gay and I came in with Mikey and Abigail. We knew their excellence all along. And we saw that Abigail was doing well and worried that Mikey would be a closer win. Man, oh man, the electorate was very clear. These two talented, capable legislators need to be governors of these states. And so I have to tell you, I'm beaming with pride over their elections and that they were not even close. The retention election here in Pennsylvania, super, along with the other judicial elections, as well as the municipal races. Bucks County, a sheriff, and the DA, those are really powerful races. And it isn't as a result of a single day's election. It's the result of great candidates and a tremendous amount of work. And I know a lot of these people on this call were part of that work. And it is people reacting to this horrific year that we have suffered. So I couldn't be happier. And I do believe, and maybe some of you saw our governor, Josh, on the TV this morning, believing this is momentum building, but that we cannot at all take anything for granted, because we know in another year of a second Trump administration, anything and everything is possible. So we cannot take our eye off the ball, our foot off the gas, or whatever cliche you want to pull from, and all of them. But I do believe everybody on this call deserves a lot of credit for getting us to this point and to Tuesday's wins. The latest on the shutdown, I know we're calling it the longest shutdown in government history, 37 days, I guess we're up to, but I want to say that really add 11 days to that. The last day we were in session, and this is in the control of the Speaker of the House, was September the 19th. September the 19th, knowing that we were 11 days from the shutdown of this government. And the Speaker shot us out of town, didn't want his members there, fearful of the Epstein files and the call to release them. 11 days before a government shutdown. So this is really a 48-day shutdown. It is, I don't have the words anymore. If some of you could send me those words that are as clean as I can use, but shameful, disgusting, dismaying. It's absolutely ridiculous. And to the questioner, Republicans aren't there. You saw I got into a conversation with the Speaker a couple of weeks ago, asking him to call his members back, demanding of him that he tell the truth about the so-called clean CR. Nonsense, absolute nonsense. Our job was not done when Republicans only passed that dirty CR. So each and every one of us is present, is available, and is demanding that the Speaker stop carrying the very flimsy water of the administration and come back and do our job. On healthcare costs, again, we are working on things like healthcare costs. Mary Gay and I just participated in a steering and policy hearing where we heard directly from folks, either constituents or from around the country, on the direct impact of the healthcare costs. Lisa from my district, from Fleetwood in my district, detailed her problem. She was somebody who in 2009, her husband died suddenly, leaving her with 3 children. And she got health care privately. She lost his employer-supported insurance. She's out shopping for insurance pre-ACA. And she got very expensive insurance and originally was denied because of pre-existing conditions like situational depression. Yeah, she was depressed. Her husband died suddenly. Wouldn't you be? But those were the old days that the Republicans are hoping to take us back to. She was denied to the point where they wound up writing the insurance in her 3-year-old son's name. She had him color on the forms and send it back to show the absurdity of it all. And of course, it was extraordinarily expensive. She's recently gotten, and so 2 of her children are now adult, but she still shares coverage with her 19-year-old son. And she's gotten notice that her ACA coverage, that has been a lifeline for them, the price will quadruple. She said basically it's catastrophic insurance only by the time we will eat through what is our deductible. It is beyond shameful. And so I wanted to just share with you that Brendan Boyle and the Budget Committee have broken down every single member's district. In my district, the 4th Congressional District, 22,000, at least 22,000 people in my district will see dramatic increases in costs, and 17 to 18,000 will lose their coverage altogether. That's just one congressional district in suburban Philadelphia. And I know a lot of districts even harder hit. So when I tell you the story of Lisa, she is not alone. Lots and lots of people are in that situation. And the Republicans know exactly what people are up against. When I asked Speaker Johnson, I said, do you realize how hard your district's going to be hit? How many people in your district of Louisiana are going to lose health insurance? Do you know what his response was? Good. Get them working. We shouldn't be supporting their health care. I don't even get that. I don't even get that response. I'll end on SNAP cuts. The SNAP cut situation is so, it's disgusting. And what I want to remind people of is while this administration has illegally stopped funding SNAP benefits, let's be really well aware of what happened before. In the big ugly law, they cut a record $186 billion from SNAP benefits. This isn't a one-time, oh gosh, shutdown, we don't know what we legally have to do. This is a concerted effort. You see it in Project 2025. They want to collapse the nutritional assistance to seniors, to children, to veterans, to families. That is their ambition, and they are shamefully doing it now. May the courts hold them to account. And Democrats are prevailing on these issues. We're going to keep lifting up these stories until they reverse those cuts, they fully fund SNAP, and they make sure we make healthcare affordable for all of our constituents. Shame on the Republican majority.
Congresswoman Dean, thank you for laying that all out. I really appreciate your remarks. And everyone on this call is being touched by this in some way, from people that they've known, stories that they've seen, all of those things. And you're right on with what's happening here. At this moment, though, it is my honor to recommend or to welcome a warm welcome for Congresswoman Mary Gay Scanlon. We've had the opportunity to work together on some community conversations, and your advocacy has been incredible. And I'd like to turn it over to you for some remarks, and then hopefully we can follow up on some questions afterwards. Congresswoman Scanlon.
That'd be great. Thanks for inviting me. And I appreciate the opportunity to talk with folks who are thinking about policy, because we can't get our Republican colleagues to come in and talk policy at all. All they want to talk about is wins and losses. And it's like, no, there has to be a basis for all of that. So as my colleagues have said, we've had Speaker Johnson keeping the House out of session and unable to act for over a month. They've shut down the government rather than come to the table to negotiate. And it's really, really frustrating, because this idea, they're saying, well, we did our job. We passed something out of the House. The idea that if you put forward a partisan bill and you manage to just ram it through with partisan votes, and you never come to the table to try to negotiate a bill that is going to work for everyone, because it doesn't just have to pass the House, it also has to pass the Senate. I mean, that's just the logistics of the whole thing before you even get to the fact that, okay, you've got a very slim margin in the House. almost half the country didn't vote for your party, and less than half of voters voted for the president. So we don't have an overwhelming mandate here. So you got to stop acting like it, and you got to come to the table if your purpose is to be there to work on behalf of the American people, as opposed to just trying to engage in power grabs all the time. But unfortunately, we're in the power grab phase. And the idea that they just keep voting on the same bill over and over, all that brings to mind for me is the definition of insanity, really, is just you keep doing the same thing over and over and expecting a different result, as opposed to going to the obvious solution, which is you engage in legislation as it was intended to be done. But this is a continuation of what we've seen for 3 years now in the House. It's that the House Republican leadership basically only goes and negotiates with its most extreme members. So the legislation that comes out tends to be very extreme, can't pass, sometimes can't even pass the House. That's one reason we don't have many appropriations bills yet, because it's too toxic even for some of the Republican members to get onto here. But then it can't pass the Senate because it can't lure more rational votes. And I hate having to call the Senate rational because I am, after all, a member of the House. But, it's a real frustration. We know that the American people are in the middle, and if we could have negotiations and talk about issues that meet, the great middle, then we would be doing a lot better than we are right now. So, the other thing with the shutdown is, in addition to the budget, there's so many other things we should be working on. All of the oversight functions, which I know, again, for power reasons, our Republican colleagues are not too interested in, but, misconduct of various members of the administration. Kash Patel apparently is using government jets to go on dates. The weaponization of the Department of Justice, both in dismissing suits or charges against folks who are friends of the administration, particularly when they've made donations to ballrooms or presidential libraries, and then prosecutions against folks who have been political challengers. That's very ripe for oversight. The abuses of immigration authorities, what we've been seeing in California and Chicago, real concerns about what might happen if it comes to Philadelphia. But in the absence of congressional oversight, through formal channels, as Madeleine mentioned, we've been doing shadow hearings. So we're having shadow hearings in the Capitol every week, and we've been focusing on the issues that are most tied to the budget, so healthcare, SNAP, et cetera, the care economy. But a week and a half ago, 19 members of the House went to Chicago to hold hearings and roundtables about the abuses affiliated with the immigration enforcement activities that are happening out there, and kind of the real lawlessness of the Customs and Border Patrol and ICE agents who are engaging in violent traffic stops, arresting people without warrants. I mean, we heard from a priest who'd been hit in the head with a pepper ball from people who were 3 floors away from him while he was standing in the street praying. There was a story yesterday about someone who has papers getting arrested at a daycare facility. I mean, it's just hugely aggressive overreach, not legal in many cases. So that kind of thing is ripe for oversight hearings. We've got the extrajudicial killings, or as some would say, murder in the Caribbean, where there appears to be no legal authorization for killing people without evidence and without a declaration of war, which is, again, something Congress is supposed to do. So there is a lot going on in addition to, AI, we should be dealing with that, crypto, whatever. But right now, what is driving what is going on right now is the need to get a budget moving forward. It does seem as though there's got to be some movement soon, because this continuing resolution, the CR that they've been trying to pass for the last more than a month now, going on 2 months, only would extend until November 21st, and then the government would shut down again. So at least the Senate has finally realized that it does not work to continue trying to flog that across the finish line, and is exploring options. will come up with, what they'll come up with, and whether it will be viable in the House will be a big question. But Democrats drew a line in the sand because of the impact on healthcare. And okay, so we have this continuing resolution. It is a very different situation than when one was passed in the spring, because since then we've had these really dramatic cuts to Medicaid and SNAP that occurred in that big bill this summer, and the impact of those cuts on our communities, on our healthcare facilities, which, as they are looking ahead to budget, are having to take into account the fact that they are going to be getting less funding from the federal government in a situation that was already kind of underwater. I mean, we've seen multiple hospitals in our region, in Delaware County, which forms the bulk of my district. We had the Crozier Health System go bankrupt this summer. Now, there were other forces in play there. It did have a private equity problem, but low reimbursement from Medicaid was a significant issue there. And the fact that there's going to be even less reimbursement coming from Medicaid led to there being not a viable path forward for a place like Crozier. So we hear an awful lot about rural hospitals, but our frontline urban hospitals, which are very dependent on Medicaid dollars, are also at serious risk, as are our federally qualified health centers. We have met with them in roundtables, and they're expressing really serious concerns about whether they will be able to keep their doors open, or if they keep their doors open, what services are they going to have to cut, because they're just not going to be able to keep providing the same levels of service. So I was at a federally qualified health center last week or the week before, and they said probably the first thing to go will be their dental services, because that's one of the lowest reimbursement. They don't get much for that. But of course, if you don't have dental care, that can lead to heart issues and other problems. So, the problem is it's all connected, and we need to support the whole system. Now, yes, there are probably improvements that could be made to, the healthcare system. Which way should we be moving? Should we be moving to a public option? Should we be moving to something else? But right now we have the Affordable Care Act, and it has been damaged by a number of things that have happened since it was passed that the Republicans have instigated, including, exempting healthy people from having to buy in, et cetera. So there've been these cuts that have made it less affordable than it was, but it nevertheless has gotten more people on health insurance and has saved lives. Right now, we've got this crunch that people are getting their premium notices for next year, and they are increasing significantly, whether you're on ACA policies or whether you're on private insurance, because again, it's all connected. And so the private insurers have to look at the whole landscape. And, until we move to a system where we're going to just let people die in the streets, we have not moved to that system yet here in the US. So someone is going to pick up these costs. And it really is a matter of deciding where that's going to happen. We've seen in my district with the shutdown, people have to drive further for care. They're waiting longer to be seen. They're paying more for it. We had been able to make some positive strides with respect to the maternal health issues that our country sees and our region sees, particularly with women of color and Black maternal mortality. We had been seeing some improvements there, and we'd gotten some funding with Senator Casey and others to have doulas and to start a birthing center in Southwest Philly. That money is drying up, and we're seeing less availability. We're now hearing about more people in Delaware County who are in their third trimester. They haven't had any prenatal care, and they're on a waiting list to get prenatal care. Well, baby's not going to wait. And we're hearing about more deliveries in ambulances because people have to travel further. So there's a lot at stake. And as if it isn't bad enough, we've seen the food assistance go on the chopping block. 2-3 weeks ago, we had a round table with state reps and local providers about what these new SNAP regulations are doing. And with all of this, it's saying that our Republican colleagues have said, oh, we're trying to eliminate fraud, waste, and abuse, so we're going to have work requirements. Well, most people on SNAP and most people on Medicaid already work, okay? So it's not that they're not working. But these new work requirements are really paperwork requirements. They have been proven in other jurisdictions that when you put these kind of requirements in, it's not that you're kicking off ineligible people, you're making it harder for eligible people to get the benefits that they should be receiving. And it can be simple things. You have to print out a form to get the waiver. Well, guess what? If you are that close to the poverty line or under the poverty line, you don't have a printer and you can't get that form. So it's these kind of roadblocks. And the one that really drives me crazy is this requirement that you be showing 20 hours of work, et cetera. If you're in one of these low-paying jobs, a lot of those employers are unwilling to give people 20 hours or more because then they're going to have to give them benefits. So there are these artificial pressures that make it even harder for people who are already in a tough position. The SNAP benefits, I think Madeleine outlined, the fact that there was money available. When we had this round table a couple of weeks ago, we weren't looking at the fact that, the government could decide to just not pay SNAP benefits because the government has always paid SNAP benefits since 1964, over 60 years. And there is an emergency fund that Congress has already appropriated money for. And if that's not sufficient, then other presidents, including Mr. Trump in his first administration, have moved money around in ways to make sure that those payments went out. Well, this November 1st is the first time ever that those payments didn't go out. And that was because of choices this administration made. First of all, not to make the payments, then to, challenge it, force the states to sue the administration. When two judges said, no, you have to pay the SNAP benefits, then they made it harder for them to go out. Our Department of Human Services, Dr. Arkush, sent a letter earlier this week saying, you have made this process so difficult, it's going to take us days, if not weeks, to comply with this process. And we had the California Attorney General agreed with that today. It's just, if you want to throw up roadblocks, that's a choice. And that's what we're seeing here, as opposed to other administrations have done what they could to protect the American people from the impacts of a shutdown, et cetera. So, obviously super concerned about our federal workers, including our staffs, who are missing their paychecks at a time when we've already got food insecurity. So we've been trying to work with our food banks and such to make people aware of what's available, help neighbors help neighbors. But it's really something that should not be happening if people were actually working on behalf of the American people, as opposed to engaging in power struggles. And that's the real frustration of all of this. I did just want to kind of highlight an issue that is really seems to me to be the fundamental political divide that we have been dealing with in Congress, particularly as we deal with budget issues. And the idea that our budgets reflect our values, and the big divide is that our Republican colleagues have been extremely focused on the national debt and the deficit, and basically have been willing to justify almost any cuts, not tax cuts, almost any cuts to public services as being necessary in order to address the deficit. But they've been only too willing to turn a blind eye to the fact that these tax cuts that they did in 2017 and then just renewed have actually exploded the national debt, exploded the deficit. So, everybody would want to work on having a more balanced budget, et cetera, but it can't all come off the backs of American people. And that goes back to this theory, I think, of trickle-down economics, that if you let the wealthiest folks have more control of their money, they will invest it in ways that benefit all of us. Really came from Reaganomics, I guess that was called. But we've now had 50 years of showing that that is not what happens. It does not get invested to the greater benefit. We have seen a drastic rise in income inequality, concentration of wealth among the wealthiest. So we haven't seen the trickle-down economics trickle down. We've seen the wealth get held at the top. And we're now in a situation where it may be what this White House and the Project 2025 people are looking for, but we're seeing kind of a return to the income inequality of the Gilded Age, as opposed to a golden age, the Gilded Age, and maybe the Gatsby era, where we had some echoes of that last weekend. That extreme income inequality was reduced by policies of the New Deal throughout the 30s, 40s, 50s, really the end of the 30s through the 80s, when we saw a reduction of income inequality. We saw a big expansion of the middle class. And a lot of that was through a progressive tax structure. It was through public investments in infrastructure, education, and health. And it was when we had strong labor unions, which could push back on corporate overreach, perhaps. And so now, as we've seen the erosion of that really through the 80s, 90s, in the 2000s, we're seeing wage stagnation, wealth concentration. It even has an impact on Social Security. This was really interesting to me, that our Social Security model was the formulas and all were last addressed in the 1980s. And based on the income inequality we had in the 80s, we would still be solvent. But because so many people at the higher end now have that wealth and they don't pay into Social Security system, that we've got those caps. That's one of the reasons that the Social Security system is in the kind of financial instability that it is. If we had maintained kind of the income spread that we had in the 80s, the Social Security system would actually be in much, much better shape. So I do think that's one of the underlying things we have to look at, and how we can, put more power in the hands of Americans, or make sure that they're getting a fair deal when we're looking at tax structure, when we're looking at labor unions, et cetera. And that's just kind of the things that I'm interested in working on. But we got to make sure that our kids are eating, and that people can, get emergency room care when they need it. I mean, there's certain basics that are on the table right now, and that's one of the reasons we're still here. So happy to field questions. Sorry, I threw a lot of this at you, but I'm relishing the opportunity to talk to people who are interested in policy.
Wonderful. Congresswoman Scanlon, thank you for going through all those things and for extending your time with us. And there's some questions in the chat I want to field to you.
Sure.
In particular, there's a comment in here I want to share with you, but you mentioned about the Affordable Care Act and how it saved so many lives and so many people. They got insurance for the first time, but yet there are still things that need to be worked on there, right?
Yes.
And acknowledging that. And so in that respect, I'm thinking about this question that was put in the chat that says, if Republicans do come to the table, and by the way, it seems like from so many perspectives, it's like they're pitting healthcare versus eating, versus food and insecurity, this fight here. But if they do come to the table, are there programs that Democrats are willing to negotiate? And then what are things that you would consider to be non-starters? Absolutely, this is not a non-starter. And I think about these permanent tax cuts in that conversation too. So just curious on what your thoughts are about that.
Right. Well, so, I mean, that is kind of going back to one of the frustrations with this big, beautiful bill, was they were only too eager to make permanent the 2017 tax cuts, which are now predicted to add $4 trillion to our national debt. But they wouldn't extend the Affordable Care Act tax credits, which benefit not billionaires overall. So I understand that some of their proposals are putting income limits on who can get those tax credits. I mean, obviously that could be something to look at, although I think by definition, we're already talking about folks who don't have, masses of income. Most of the folks on the Affordable Care Act are small business people, farmers, et cetera, but certainly there could be discussions around that. I'm not a big fan of these paperwork requirements that are really just excuses for throwing up bureaucratic hurdles, which again, I think is a little bit disingenuous when our Republican colleagues are always quite exercised about whether or not there are permitting requirements or something that are impeding development, but they're willing to put up paperwork requirements if they don't impact their business interests. So I think we could talk about a lot of things, but basically everything that's been put forward so far has been ways to undermine or repeal in all but name the Affordable Care Act. I mean, we have a Republican Party that is still trying to achieve repealing without replacing. mean, we just heard last week from the speaker that, oh, they've got some ideas. Well, it's 15 years too late. We, 2 weeks from now, we might have more. And pardon my skepticism, but this has been something that Democrats have been talking about all year as we headed towards this. And it was certainly something that we raised repeatedly, including during all-night Rules Committee meetings and debates as this big bill went through, that we have to address the healthcare issues. And to now be told, oh, well, pass this crappy CR that we've sent over, and then we'll talk about it, when they haven't been willing to talk about it for 10 months already. Fool me once, shame on you. Fool me twice, shame on me. So there's not a lot of trust right now, and that's why there's such pressure to have a deal.
Congresswoman Scanlon, thank you once again. I know you've stayed a little bit longer than you said you were going to be able to
That's
here,
fine.
but I'm glad, and you're welcome to stay. I would like at this point, however, to turn it over to our executive director, Mark Steer, for his takeaway from what we heard from all three members of Congress and the work in front of us, and where we see things going, and maybe even help us to field a few questions that we have here. But you're welcome to stay and chime in at any moment. So
I see my scheduler starting to twitch, so I think I'm going to have to go.
I thought that was going to happen. So thank you
Yes,
so much.
but thank you for letting me speak with you, and look forward to doing it again.
Thank you. Thank you.
Okay, bye.
Okay, Executive Director Mark Steer, the Pennsylvania Policy Center.
So first, I want to say thank you to our members of Congress, Boyle, Dean, and Scanlon, for joining us today. I think we're really lucky that we have them there fighting for us in Washington, and being focused in the kind of detailed way on policy issues that you don't see very much in all of our politicians. I mean, they know this stuff inside and out, and I think they showed us that today. I am putting a couple of things in the chat for your enjoyment. The first one is a fact sheet on that basically looks at the statewide impact of the failure to extend the premium tax credits and the Medicaid provisions in the One Big Beautiful Bill Act. That'll just give you an idea of just how bad it is. And I know many of you are engaged politically and are talking to other folks all the time. Take a look at that fact sheet, and that will help you make the case as you're doing your advocacy work. We will have additional fact sheets for each individual congressional district as well coming soon. But the second thing I put in is actually our long paper called The Trump Threat to Pennsylvania's Healthcare. At the end, that's an in-depth analysis of exactly how the Republicans have been trying to undermine healthcare and health insurance in the United States, what its direct impact in Pennsylvania is. And at the end of that, there are a number of tables that look at each county, each Senate district, state Senate district, each state House district, each U.S. House district, and shows how many people will in fact lose health insurance as a result of both the cuts to Medicaid and the failure to extend the premium tax credits at the ACA. So that's there for you all to look at and to use as you're talking to folks. The second paper is pretty long and in depth, and I know some of you may find that interesting. But if you don't, just go to the end and you'll find, how bad things will be in your own house district. Sorry. So I want to just say two other things, and then maybe I can take some other questions if we have them. We're not only just seeing rejection of negotiations with Democrats and a failure to push to keep on healthcare and a failure to push to keep SNAP open. We're seeing some of the most awful rhetoric coming out of the right about the people who rely on SNAP and rely on Medicaid. And I want to draw some attention to it. If you haven't seen it, great. It's unfortunately part of my job is to keep track of right-wing voices, and they regularly disgust me. I mean, we're seeing some of the most racist stereotypes about who is on Medicaid and who is on SNAP. The truth is the majority of the people are white. stereotypes about whether people are working or not, saying people on SNAP or Medicaid are lazy and not working. Again, racist stereotypes, but they're applying to everyone. And again, it's not true. We know that the overwhelming number of people on Medicaid and SNAP are either working, going to school, taking care of small kids or seniors who can't care for themselves. Very few people aren't working. And if you had any brains about it and you realized how little people get from SNAP, you would know you've got to work to keep yourself and your family going when you're on SNAP. So I urge you to make it clear to everyone, the reason people get Medicaid and SNAP is because wages are too low for people to afford the food their family needs and to afford health insurance. And when it comes to health insurance, I want to make a point that I've made before, but it's, I think, really important to keep people in mind. No one in this country gets health insurance without government support. Absolutely no one. When people say, "Well, I pay for my own health insurance." Um, you may be paying part of a employer-sponsored health insurance, but your employer's paying some of it, and that is tax deductible. You don't pay taxes on those benefits. So the amount the federal government spends through lost tax revenue on the business and employer-created health insurance side of things is 5 or 6 times greater than the amount it spends on the ACA. It's a huge amount of money. No, so if you get employer-sponsored health insurance, even if you're being part of it, much of it is subsidized by your employer, and that is tax deductible or untaxed rather, and that's a big federal subsidy. Obviously, if you're a senior on Medicare, you're getting federally subsidized health insurance. So health insurance is just one of those things that either the government pays for it or we're not going to get it because it's just too damn expensive for everyone, and we got to spread the cost around um, to make it affordable for all of us. We also have to make it create a huge healthcare system, which is federally subsidized. Our doctors' training, the building of hospitals, all of that comes from federal money. So we are all reliant on federal help for health insurance. So don't let anyone talk about lazy people, people who are not working, as the ones who are taking all our money for health insurance. We are all getting it. And most of us get a lot more from the government than people on Medicaid. So let's see if are there any questions that you want me to answer? I see someone pointing out SNAP benefit is very low. I think $187 a month. Yeah, that may be right for about one person.
Mark, I see in the chat something, and many of us on this call I know have been very active right now around what's happening with SNAP. There are food drives that are going on. People are mobilized, doing the best they can because they know how serious this is, especially coming up to the holidays, which just seems to make it worse for families that are dependent on this for whatever those reasons might be. But one of the questions in the chat, and maybe you can shed a little bit of light on this. Is there anything that you might be able to tell us about the USDA release of partial SNAP funding to states and what that might look like? I know there's been some changes that even today, so it might be a little bit, I'm not sure what you might be able to shed there.
It is changing from day to day. And it's enormously complicated. I was on a call yesterday, and where someone from the Center of Budget and Policy Priorities was trying to explain what will SNAP benefits look like. And there just is no simple answer. Because there's not enough money, federal money coming into the system, because it's very late, it's going to take states a while to figure out how to even release the funds. And then there are complicated formulas, and are too complicated for me to even talk about right now. And I'll admit I did not fully understand them. I was driving during this conversation yesterday, and I didn't get every last detail. But the bottom line is, some people may get full SNAP benefits, some people may get nothing, some people may get 30 to 60%. It's just, there's no consistent answer to this. The only solution to all of this is to get all the money and get it out the door as quickly as possible. We have to fully fund SNAP, and if we don't, there are going to people who are going to starve because they will be one of the odd people who get nothing from the federal government. So it's been really horrible, and um, there's just no solution except the Trump administration actually following the law, releasing the emergency funds, transferring other funds as they're allowed to do, and make sure people don't lose those benefits.
Right. And, I don't think it's lost on anyone either that we seem to be able to find money to pay ICE agents. We seem to be able to find money to pay other priorities of the president, but this doesn't seem to be one of those. Although I think that maybe a corner might be turning on this with some statements that he's made. We're coming right up to the end of the call at the top of the hour. Mark, I didn't know if there was anything else you wanted to comment on before we wrap things up. Do you have
So
anything?
I just Jennifer asked, is there something that we've written about the fact that everyone gets health care with government support? There is a piece I wrote a number of years ago called "Healthcare Must Be Communally Provided." I don't quite have a link at my fingertips, but I will. We'll follow up on this call and we'll send that link around.
Sure. And that's a good reminder too. If you go to our website, Pennsylvania Policy Center, .org, go to that website. There's the latest publications that we have that are available for all of you. There are blogs there. There are resources, kind of like some of the things that Mark shared in the chat, and you should all help yourself to those. I saw that there was a question in chat to talk about the lack of a state budget. I'm happy to say that my colleague Jeff Garris is on here. We'll be holding a state policy call. We do that usually the third Thursday of the month at 1 o'clock. If you're on this call, you will get an invitation to that call as well, which brings us up to the top of the hour. So I want to thank you, Jeff. Did you have any comments that you wanted to share there? No, you're good. Okay. I want to thank everyone for joining us today. It was quite remarkable that we ended up with 3 members of Congress through all of this. And I want to thank my team at the Pennsylvania Policy Center, all of our partners at Pennsylvanians Together, who have been working so hard to make sure that we take care of everyday Pennsylvanians, that we have the policies and we have our priorities straight when it comes to our budgets, that Pennsylvanians should not be just getting by, they should be thriving. And so welcome to this call. Please share it with others when the next ones come up so you can have the latest information. We're going to get back to work here, but thank you so much for joining us today.